Gentlemen, let's talk about a topic many of us, especially after 60, may feel hesitant to discuss openly: masturbation. It's a completely natural and healthy part of human sexuality, and for many men later in life, it remains important for both physical and emotional well-being. However, in my years of clinical practice, I've seen that after 60, certain habits or approaches can start to cause discomfort or even lead to potential health issues over time. Today, I want to explain how to masturbate safely after 60 and, more importantly, highlight 3 common mistakes I frequently see that you absolutely need to avoid. This isn't just about pleasure, it's about prostate comfort, overall health, and maintaining a fulfilling sexual life for years to come. Keep in mind, this information is for educational purposes only and is not a substitute for personalized medical advice. Always consult your own doctor regarding your individual health needs. Over the years, one thing has become very clear to me: addressing all aspects of men's health, even the most personal ones, is essential. Masturbation is a normal human behavior at any age. For older men, it may offer benefits such as stress relief and improved pelvic comfort. Some studies suggest that regular ejaculation may help with fluid turnover in the prostate, although the evidence regarding prevention of prostate disease is mixed. Still, the reality is that our bodies change with age. Skin and tissues can become drier, sensitivity can shift, and techniques that once felt fine may now cause irritation or discomfort. The activity itself remains normal and healthy, but how you engage in it becomes far more important for long-term comfort and well-being. One of the most common issues I see in men over 60 is not using enough lubrication, or not using the right type at all. As we age, natural lubrication often decreases. Engaging in friction without enough glide doesn't just cause immediate discomfort, it increases the risk of tiny injuries to sensitive penile tissue. Over time, repeated tissue injury has been associated with conditions such as Peyronie's disease, which can result in painful curvature. The safer approach is simple: use a high-quality lubricant regularly. Water-based lubricants are easy to clean and widely compatible. Silicone-based lubricants last longer and can be helpful if you have very dry skin or longer sessions, though they shouldn't be used with silicone-based toys. Oil-based lubricants should never be used with latex condoms, as they can damage the material. Apply lubricant generously and reapply whenever needed. Think of it as protecting delicate tissue, not just enhancing comfort. Another frequent concern is using too much force or an overly aggressive technique. Many men develop habits earlier in life where stronger pressure seemed to increase sensation. After 60, this approach can be counterproductive and even harmful. Excessive force, squeezing, or bending can put unnecessary stress on erectile tissue, small blood vessels, and nerves. This can lead to bruising, lingering numbness, or longer-term damage, and paradoxically may reduce sensitivity over time. A safer alternative is to focus on gentler, rhythmic movements. Prioritize comfort and sensation rather than intensity. Slow down, be mindful, and allow pleasure to build naturally. Always listen to your body. If something feels painful or unusual, stop immediately. A third issue many men overlook is hygiene after ejaculation. While it may seem minor, proper cleaning is important, especially for men with conditions like diabetes or an enlarged prostate, which can increase susceptibility to infections. Residual fluids left on the skin can encourage bacterial growth, potentially leading to skin irritation or urinary tract infections. A simple, effective routine makes a big difference. Wash the penis and surrounding area with warm water after ejaculation. If you use a cleanser, choose one that is fragrance-free and pH-balanced for sensitive skin. Avoid harsh soaps, and dry the area thoroughly afterward. This basic step supports skin health and significantly lowers the risk of irritation or infection. Being mindful of these practices after 60 is about more than avoiding short-term discomfort. It's about preserving long-term sexual health, nerve function, blood flow, and overall comfort. Treating your body with care, especially sensitive tissues, reduces the risk of injury and infection and supports a healthier sexual life as you age. Pay attention to your body's signals, be willing to adapt your approach as sensations change, and remember that frequency is a personal choice with no universal right amount. Hygiene before and after sexual activity remains essential. Finally, It's crucial to emphasize that while these guidelines promote safer habits, they do not replace professional medical care. If you experience persistent pain, bleeding, unusual discharge, concerning changes in sensation, ongoing erectile difficulties, or anything else that worries you, seek medical attention promptly. Early evaluation and treatment are always the best course of action. Masturbation remains a normal and healthy part of life, and with thoughtful, mindful practices, you can continue to support comfort, confidence, and sexual well-being well into later years. If you found this information helpful, take a moment to support the channel by liking this video and subscribing for more science-based men's health guidance. Turn on notifications so you don't miss upcoming videos focused on staying healthy and confident after 60. Share your thoughts or questions in the comments. Your input helps shape future topics and may help other men facing the same concerns.